Hello, everyone, and thank you so much for joining us on our live stream from the Florida School of Massage community. And for those of you that don't know me, my name is Christina Polnyj, and I'm here with Jackie Ferber. And behind the scenes, we have Sarah Thompson and Chrissy Martinez, who I'm just so thankful for, because without them, we would not be here. And we have been very motivated and inspired to just continue to get creative and find ways to stay in community together. And of course, we are not at the school, but rather coming to you from our respective homes. And we're so looking forward to resuming classes as soon as we can. But in the meantime, I know we have a variety of listeners from all different backgrounds. And some of you are very familiar with our community. And for those of you who are brand new, I would just like to say welcome. And absolutely, we are a massage school, a professional training program. And yet it's also so much more than that. And many of our past students and graduates and professionals continue to return to Gainesville for continuing education and advanced trainings, or just to dip into our place of ongoing learning of not only body work, but also the exploration of our inner world through this vehicle of touch, awareness, communication, both verbal and nonverbal. And we are still working from home, and we've really been looking forward to this time together. And we're going to have about an hour to talk about what lies beyond the technique of massage therapy. And we'll reserve time for your questions and comments towards the last 15 minutes or so. And I know you're either joining us on Facebook or YouTube, so please type your comments or questions into the chat, and Sarah and Chrissy will be monitoring those for us. And if you're joining us on YouTube, you can also go ahead and like this video and subscribe to our channel by hitting the red button below. And you can also hit the notification button so that you get reminders. And for those of you joining us on Facebook, you can like this video and follow us there. Again, my name's Christina, and I've been a part of the Florida School of Massage since 1992, and I could not be more excited than to be joined by my dear friend and fellow instructor, Jackie Ferber Landis. And so, Jackie, you have been a part of our community since 1986. You're a massage therapist and an instructor here at the school. You've taught a variety of different things over the years: kinesiology, sports massage, boundaries and ethics, business skills, and of course, you were one of my favorite teachers. And you're welcome. And I know I have some listeners who may be new to the Florida School of Massage community, and of course, some listeners will know you very well. So before we move into our discussion, why don't we just start by telling us a little bit about your background and what inspired you to study massage all those many years ago? 34 years ago, my goodness.
34 years ago, I know. And can you hear me okay?
Yeah, you sound great.
It's interesting to reflect back, and I'm excited to be here and share whatever 34 years has brought me with all of you. I actually started massage school, surprisingly, probably a lot of you, in 1985, which was before I actually finished school. I was working full-time in a children's psychiatric hospital as an activity therapist and in a relationship, and was really dissatisfied with both of those situations, and always had been an active, athletic person, and decided that I was going to study massage and try to work full-time, and that didn't work. It was just too much. So instead, I took a huge risk, and I decided to apply to Vermont bicycle touring, where I had taken 2 bike trips myself, and see if I could get hired and totally make a big change in my life. And that's what I did. I sold everything, broke off my relationship, quit my job, did everything in a huge risk, and Vermont Bicycle Touring hired me, and I moved to Vermont not knowing a soul. And while I was there, I met a good friend of mine, still today, Sally Burrell, who was a fellow bike leader, and she had been dabbling in massage and said, "Hey, Jackie, isn't there a massage school in Gainesville?" And of course, I had already started. And she goes, "Let's go when the bike tour is over," which was at the end of October. We just packed up and moved down to Gainesville, got a little place in the duck pond, and rode our bikes to the massage school every day. And that was January through May, so it's exactly 34 years ago that I did that.
Wow.
And and then the wonderful thing, maybe not so wonderful, Vermont doesn't have licensure. It didn't have licensure then. And so we were able to, come May, we moved back and led bike tours and started doing massage on all the cyclists right away. We didn't have to take the license. There was no licensure. So we were able to have a lot of experience with a lot of people right away, and they loved it. The cyclists loved it. People loved the massage. So that was the beginning of how it all happened. Yeah.
Wow, that's such a great story. And, even though it was all those years ago, it's so relevant to the times we're in right now, because so many people are in the position of maybe not having a job and thinking about changing their career and looking at making radical changes in their lives. So it's amazing when you're courageous and make a brand new start like that, how it could really just totally change the direction of your life. And wow, thank you so much for sharing all that history with us. And I know that now, all these years later, in our community at the Florida School of Massage, that so many people would consider you to be an expert in massage. And I wonder if you could just talk about, I know you're just such an experienced therapist, and I also know you to be a very humble person. And I would just like you to talk about what that means to you to be considered an expert.
Yes. I would tell you that I'm an expert in Jackie Ferber massage, and that's the only thing I'm an expert in. Because I feel like after 34 years, I consider myself a lifelong learner, and I think anyone who gets in this profession, there's so much to learn. And even after 34 years, I still have so much to learn. I'm always taking classes, watching videos, and I feel like each of us comes into massage as our own unique, person. And even though 34 years brings me a lot of, people that I've worked with and experienced, the act of being an expert, I've gotten massages from our students right out of school, and it's been incredible therapy. And I feel like no matter how long you're in it, if you have a love and a passion for it and you just do what's right for your own self, then some of the work that I've gotten feels like a seasoned therapist from people coming right out of our school. So, I consider myself to have a lot of experience, but I'm just the only expert on myself.
Yes, that says a lot of good things, not only about the people that we get here as students, but also about our teaching staff. I have a very similar experience where I call it like the miracle of massage school, that immediately even after 6 weeks of the program, they're already doing such amazing work. So thank you for sharing that.
I wanted to say one more thing about that, and that is that I don't say this because I went here and because I'm a student. I was a student here and I teach there, but the Florida school standards of education and how they are educating the whole person, I've gotten massage from seasoned therapists across the nation, and so many of our students far surpass that kind of work. So I just want to say that, and not as a PR thing, but it's really true. The standard of education in our program is pretty incredible.
Yeah.
So,
It's really true. Thank you so much for that. So today we're going to talk about what lies beyond the technique of massage. And I love that topic because when I think of technique, or when we talk about technique, we talk about relaxation massage, deep tissue work, sports massage, neuromuscular therapy, reflexology, energy palpation, all the variety of different subjects and modalities that we teach here at FSM. So I'd like to ask you, like, what comes to your mind when we say beyond the technique?
I have thought a lot about this because, students a lot of times will be very hard on themselves. They can't get this particular stroke, or they can't get this, particular technique. And I feel like there's three things that are really important to me. One is to inform myself about the client, and the second thing is to be educating myself all the time on everything, about people, about technique, about, injuries. The third thing is what Mary talked about last time, which is really paying attention and following my intuition. So the first thing that's, to me, is beyond the technique is, as my friend Benny, who I'm so happy is going to be here, says, the therapy starts when somebody pulls in your parking lot. Mm-hmm. And I consider, in terms of going beyond the technique, that when somebody is walking in my door, that begins their massage experience. They see what the room looks like. They see if they feel welcome. Does somebody greet them at the door? Even things like scent. Like, my good friend Christina can tell you a lot about scent. And the aromatherapy, and I mean that in sort of the broadest sense, that when people come in our office, it's almost inevitable that they say, God, it smells so good in here. And even last week, we had our Cox cable put in our office, and the Cox guy walked in and he said, it smells so good in here, So it's just it's one of those things that begins the experience for somebody when they walk in, before they even have filled out their intake form. How are they presented? So the first thing I would say that goes beyond the technique is, what is that like for you when someone comes to you? What's that first experience, as they say, first impression?
Yes.
And then I would say, once they walk in the door, right, I would sit with them and let them have their experience of filling out the intake. Don't hover around them. Give them space. And once they've filled out that intake form, sitting down with somebody face to face on an equal level, that's a really important thing. And I know that Benny's talked about this too, but not standing above them, not being below them, but really talking person to person and listening to them deeply, what their story is. Because so many people who have pain, people don't listen to the whole story. A lot of the medical profession is in a hurry, and we have a whole hour or more. And so really listening, why were they referred to me? Do they have an injury? Are they here for relaxation? Are they about to run a race? Can they not do their sport? Or, what is it that's brought them to me? So that would be the second thing.
Yeah, that's great, because really what you're saying is that massage starts before you even touch the person, before you actually are in the room with someone on the table, and before the actual hands-on part starts. And so as the massage begins, what are some of the elements that are, again, what you consider beyond the basic technique?
Okay. First of all, I do look at people's age and what they do and activity, but I also kind of just ask them about their lifestyle. Are they super busy and they fit, exercise or whatever's going on in their life? Are they driven? Are they relaxed? Are they, intrinsically motivated? Do they need someone to tell them what to do? So really getting to know that whole person. What's their family like? That may sound irrelevant, but even things like, if I do already have a client, even, remembering their daughter's name and how they're doing, and that kind of rapport building is so important, and that starts with that first intake. So listening to them, having them point to me where they're really hurting, You know, do they want work on that one spot right away, or do they want, you know, sort of ongoing massage? So really being a deep listener and not only just reading the intake, but reading the person, that would be the second thing that I would say.
Well, those are all really great things. First impression and really good listening skills, it sounds like. And I know that's a core part of our program as well, communication skills. And another thing that we talk a lot about at the Florida School of Massage is, of course, professionalism and also safety and what that means to you. I don't know, maybe you could share some more details about safety, and how you create that and how you build that rapport with a client.
Yeah. The safety begins as they walk in that room, and once we've completed the intake, and this isn't exactly a safety thing. This is more of a deep listening professionalism thing. If somebody says to me, my back is really hurting, or I have this tennis elbow or carpal tunnel syndrome, I'm going to file that away and I'm going to say, you know what, I'm going to start right there. It may not be the only place I work, but that to me begins that safety and the rapport, like that my therapist actually really just heard me. And she went right to where I needed the work, you know, because we all know, those of us who are in massage know that there can be other muscles that dictate pain that we may know about and they don't. But the idea of touching somebody where they're really hurting starts that trust. And I feel like that trust is so important. And there's a lot of talk about draping and there's lots of philosophies. I feel like as much as I can be clear to the person that they may leave on any type of clothing that they want and still get good therapy, or the opposite. If they take clothing off, they're going to be completely safe and draped. And beyond the draping, even saying to them, if it's too cold in here, if the music's too loud, if my pressure's too much, giving them permission to really say something to me. And what I always say to clients, especially the first few times, I say, it's not going to hurt my feelings for you to be really honest with me, because I want you to be getting the best massage possible. And I could do the most perfect stroke on somebody, perfect technique. If they're too cold or they're distracted by the music, that stroke is not going to be perfect for them. So that would be what I would say.
Yes, I love that. That's so true. And what other tools in education feel as important, if not more important, than the technique?
You know, I was thinking about when I first got out of school, and I was one of these people who was hungry for information. Like, I feel like massage school for me was just a tease of the beginning. And I was an avid workshop taker. You know, I took lots of education, but I also bought some significant books. Listen to Your Pain, Ben Benjamin's book, just various Janet Travell's book, which are myofascial pain and dysfunction, things that I felt like I could use and became a library for me. And when I didn't know something, I was constantly looking it up. And when I look at, now I've had my office, I've seen hundreds of therapists come through and become massage therapists. And what I see people being successful, it's the people who are driven to learn and to keep teaching themselves and always be willing to open a book if they don't know something. And so that to me is and also getting massage, like not just giving massage, but getting massage and being educated on how that feels and remembering what that feels like.
Yes, I can relate to that too. All these years later, I love to get massage, and I'm always learning and inspired by the creativity of other practitioners. And that's really, really true for me as well. So, what would you say to someone, like maybe you could give us some practical scenarios of different times in your practice where perhaps you weren't quite sure of exactly what to do, especially early on, and how you were able to later either study or look in your books or just some practical examples for our listeners, especially for those who are starting out and don't necessarily have a lot of advanced training under their belts.
Mm-hmm. I think, going into, say, your first 6 months or first year of massage, again, really listening to the client, being able to use whatever skills you have at that moment, and then be willing to, the next time they come back, have already done some research and improved yourself by self-educating yourself. Like maybe learn more about a particular muscle. I teach kinesiology, and I feel like kinesiology is one of those things a lot of people think, oh, I have to memorize the muscles and, learn my anatomy. And what I see kinesiology at is a way or a means to make your massage more effective. And so an example that I would give you is I had a client who came in, she's a runner, and she came in and she said, Jackie, she goes, I'm having some bad foot pain and I don't know what it is. I don't remember doing anything. And so I asked her, I said, well, where is your foot pain? And she pointed, for those of you who know, to the outside, the lateral part of the foot, and then underneath her foot. And basically what she was drawing and my mind was interpreting was a muscle called fibularis longus or peroneus longus. It goes down the leg and underneath the foot and attaches on the bottom of the foot. And we're talking, and she hasn't even gotten on the table yet, and we're talking, and I said, she runs it early in the morning in the dark because she works. And I said, by any chance did you turn your ankle? And she's like, oh God, yeah, I did. I twisted it the other morning. I stepped on a curb, and what happened was I start to take my education and my information about this person, and I used my anatomy, my kinesiology, and I think, okay, she probably sprained part of her ankle and also strained part of that fibularis longus. So using my education and my conversation with her, it's going to dictate my massage, and I would say for every person to do that. Use your anatomy and kinesiology and use that information so that I could cover that whole stroke with her. I could work on the bottom of her foot. She felt like a new person when she got off because it's a combination of knowing anatomy and also knowing massage. Does that make sense to everybody?
Absolutely. Well, it makes sense to me. We'll find out later if we have more questions. But the other aspect of that I would just like to ask you about is, do you remember those early days in your practice when you may not have had fibularis longus in your mind? What you would do in a situation like that, like the very first time somebody came to you, like how would that inspire you to, beyond the technique of knowing how to do, let's say, a deep tissue stroke?
That's a
Do you
good
talk
question.
more about that?
What I would say is that as years go on, and even in the very beginning, I feel like even my first 6 months out of school, and even during massage school, I did the best I possibly could with the knowledge that I had. And so if somebody told me, for example, for that client, if somebody told me that and I didn't have that information, I would say, oh, okay, the outside of their leg and feet or foot is really hurting. I'm going to take my connective tissue strokes or my NMT, and I'm going to just do that in that area and see if that helps. So I may not have memorized that actual muscle or the actual origin insertion at that moment, but if I can pay attention and I can communicate with that client, I can say, how does this feeling? And they may say, oh, you're right on it, or move a little to the right, or, so relying on the client's communication and the knowledge that I have at the time, and then building on that every time a new person comes in. Yeah, you don't have to know everything at first,
Yes, I remember my own early days, and I remember after every massage being so excited to pull out my books and look at my anatomy again and look at my kinesiology again so that I could remember, oh yeah, I do know that muscle. I knew that muscle, just to reassure myself.
Yeah,
In
and
other
that's how
words,
you learn,
in other words, what I hear you're saying too is that in the beginning, you're just in this form of high-speed learning. And that just continues even 34 years later, this high-speed learning. That's so great.
Yeah, it really
Yeah.
does.
So I'd like to just change directions a little bit. And you mentioned earlier in our previous live stream, we talked with Mary Reese and we talked about intuition. And I wonder if you could talk a little bit about what that means to you and how, again, that takes you beyond the technique, and what intuition in general means to you as well.
Okay. I've thought about this a lot because, you know, the word intuition kind of gets sort of the buzzword and, you know, knocked around. Oh, you have to be intuitive in your massage, and or you have to be educated in your massage, or, you know, there's so many things. And that's why I've always felt like informed and educated and intuitive all go together. And so an example of that would be, once I've informed myself about the client, and I know a lot about their lifestyle, how are they receiving work, what their sort of their modus operandi is for their own life. Are they, you know, kind of driven, again, like I said before. So again, educating myself about that person and knowing how they receive massage. Like, are they totally relaxed on the table? Are they tensing up? And all of a sudden, my massage starts to sort of be molded to that individual and how they receive massage. And while I'm working on them, I might have what I call a little whisper of an intuition. It might say to me, you know, Jackie, you really should go check out their low back. Or you might want to check out their right lateral thigh. It's just sort of a little, it is just a little whisper that says, could be nothing to do with what I'm working on. I may be working on their neck. And what happens for me, if I can be quiet enough, and even if a client is talking away, which is their prerogative, right? I still have to be quiet enough to pay attention to that little whisper and follow my instinct. And inevitably what happens is the person goes, oh my gosh, I had no idea that was so tight. And, or that just feels like the biggest release for me. And it's happened so many times in my 34 years where I follow that little instinct, that little whisper. And almost, you know, I'd say 99% of the time the person responds in such a positive way that it encourages me to follow that. And that intuition is also based on my education of the body. They're not separate. They're really intertwined. So, yeah.
I know that you also have a very busy practice and many regular clients who you've known for years and years, and that you have built a lot of relationships over the course of your practice, and a lot of, as you say, rapport that is really important and foundational in your practice. And I wonder if you could just talk a little bit about that, like things like how you think about how you can support them, say, in between the very first time you see them and in between towards the next time that you see them. So I'd love to hear your thoughts on that, because that feels like also beyond the technique, like what happens as you think about how long you're going to treat them, and will they be coming back in 1 week or 2 weeks? Yeah.
The one thing I want to say, you know, this topic is about beyond the technique.
Yes.
And I want to just be really clear. Technique is important. It's not like irrelevant. And that, you know, having good skills and practicing good skills is really important. But the one thing I want to say of rapport building is that as many times as I've had somebody say, oh, you've gone the right spot, or I really feel better because you worked here, I've also experienced this, and I've talked to many therapists who've experienced this, that there's some days when I just feel off. I'm not making that connection with with the client, and I feel like I'm not in that flow or in that intuitive place.
Yeah.
And what happens so many times, and I know, Christina, you and I have actually talked about this.
Yeah.
A client will get off the table and they'll go, "Oh my God, that was the best massage I ever had." And it's just like, I was not there in that place, you know. And what I realize is that all the stuff that's come before, all the trust building, the rapport, the idea that I'm there to care for them and help them, that's why they feel like it's the best massage. I may not have had that, you know, flow or technique or intuition, but all that other foundation was there, and so people feel better just being on the table getting care, you know. So that's one thing, and then the other thing is making sure that I make a connection during the session, after the session. So we sit down together and I check in how they feel. And I almost always give them homework, because I feel like there's something I heard, it's called soft tissue hygiene. And what that means is we don't wait to brush our teeth. So we shouldn't be waiting to take care of our bodies. And so and clients really want to do homework, and they want to do their health care. So I'm always giving them things to do when they go home, or shooting them videos on my iPhone, you know, or just, you know, giving them information so that they can continue their own therapy and they're not just coming in to be fixed. Yeah. So does that answer that question?
Absolutely. That's such a good point. And I love what you said too about because Mary and I were talking about this a couple of weeks ago when we were discussing intuition and just talking about awareness and how we start to develop our confidence in intuition and believe that we are connected to our intuition. And oftentimes, and this is a very relevant topic in 2020 as well, we have a whole different story going on inside our heads, or what we call maybe noise going on in the background. Like, in other words, our mind is going. And as you say, the technique is important. Like, it's very important to be grounded in technique. And we might have a whole thought process going on in our head as well. And we're being very present with our clients all simultaneously. And one doesn't really cancel out the other. So I wonder if you could just talk a little bit about that, how that is for you in your practice, if you can relate to that.
Yeah, I think, you know, it's easy to use the sort of the cliche of being present, you know, and I think that ideally that's really the perfect thing to do for an hour, but my mind wanders, you know, and I think what really brings me back is really saying to myself in every session, even if I know I only have an hour, that there is no rush in this session. This is the time for this person, and I'm going to totally be paying attention to what I'm feeling, following different tight patterns that I might feel, checking in with them. So although my mind might wander, I'm still paying attention to them. I'm paying attention to my intuition. And I feel like the slower I can slow down and make that hour feel really slow, and pay attention to that person in the moment, that even if my mind wanders a couple seconds, it's easy to bring it back. Yeah.
That's great. And I also wonder too, many of people who might be listening, many of the people who are listening know you very well, of course, and some of them may not know that you also run a very busy clinic, Advanced Massage Professionals, here in Gainesville, Florida, and you've been doing that for a long time and in practice for a long time. And I imagine, like, some of the lessons that were so good for you even early on in your practice are still really relevant today. And I wonder if you could go back in your lexicon of experience and just maybe share some of those stories or early lessons from starting out that would still be very appropriate to being here in 2020?
I have a lot of thoughts about that because I have had the privilege of seeing so many of my therapists. I've had this business since '94, and I've watched brand new therapists come and go and be successful or change professions. So I've seen this sort of ongoing, sort of process that each new therapist goes through. And
Yeah.
some of the things that are just the very basic beyond the technique are you on time? Are you present in your room is totally ready when that person comes in? Are you professionally dressed? Do you not cancel on people the last time, like the last second? Some of the things that every person has in a normal work ethic, I feel like in massage is as important or super important, because not only is that important in any job, but the idea that we're going to be touching somebody for an hour intimately with, either little clothing or no clothing, that professionalism of the safety and being on time and communicating well, all those things are what start somebody's practice happening. Because if those things are in place, somebody's not even going to get on your table to begin with. So those are things I've learned. And then there's a whole business aspect. There's things that you have to know about running a business. We do this in school. Your taxes and keeping good records and stuff. And a lot of massage therapists, they're very sort of intuitive, kinesiological beings. They don't have that mind, and I think that's something that you really have to teach yourself to be successful.
Yes, and I know you teach that at the Florida School of Massage as well, so we're lucky to have you in that class. I wonder too if you could share some of the fun things that you did as you were early on building your practice. Like, I know you've done a lot of community events, a lot of traveling massage and things like that. Things that really helped you not only gain experience, but also build your practice. Just some of the things that come to mind that were really fun for you.
Yeah. Moving back to Vermont was very fun because I took my table into barns and into, on the end of long bike rides, and that whole experience of being able to work on people in these beautiful bed and breakfasts. The one beauty about massage is it's so adaptable and so movable, and being able to do that kind of fun massage when people are in a really good mood. And then meeting Benny and having the opportunity to work at the University of Florida and work on many different sports teams. And then connecting and really becoming the massage therapist for the men's swim team at UF. And
oh, how fun!
They at that
Go Gators.
year, go Gators. They had Barcelona was the Olympics, and 3 of our swimmers went and medaled. And so that was very exciting, having been working on these guys all this time.
Yeah.
So I traveled and I lugged my table, across pool decks and, for 3 years, and worked in hotel rooms. And those guys were just the best. It was so fun. And then I met 2 professional track athletes through Benny and traveled with them to some of their national championships. So that was an education, making sure that, I just, a lot of a lot of protocols when you go to these national events. So that was very different than working on a bunch of cyclists and mountain bikers. And then, being able to work on many different teams after that at UF, gymnastics, track, a little bit of tennis, and
how fun.
That level of collegiate athletes. Yeah, so I would say my whole career has been pretty fun, really.
That's nice to hear after 34 years.
Yeah.
And knowing you for the sports enthusiast you are, it sounds like you were really able to take your passion for sports and just follow that in your career. Yeah, that's so fun. All right, well, I would like to take a pause and actually a couple of things I want to say. One is you can go ahead and like this video if you're watching us on YouTube. You can subscribe to our channel. You can follow us on Facebook. And I'd like to now invite Sarah in. Sarah and Chrissy are behind the scenes monitoring our Facebook and YouTube live stream. And I just want to see if there's any questions or comments from any of our listeners, Sarah, that you'd like to have Jackie answer.
Sure.
Can you hear me, Sarah? Hi, Sarah.
Hey. Lots of great comments and questions, people, students that know both of you and are appreciating both of you. I hope we can get to all the questions, actually.
That's exciting.
Let's start.
Go ahead.
Yeah, let's start with Joanne's question about, like, Jackie, what are the biggest changes you've seen in the massage industry since you've started practicing?
That's a good question. Mainstreaming massage, like, when I first started out, and I'm sure Benny will speak to this, but massage therapy in for example, the Division I university scenario, he had to really push for that. By the time I came along, it was more accepted. And physical therapy, would poo-poo massage, and now almost every physical therapist that I know, and general physicians, and so many mainstream medical professionals and sports professionals they've made massage a part of their world. Like they really feel like it's necessary. So that's the biggest change. We're so much more accepted now. Hope that answered your question, Joanne.
That's awesome to hear. And another question I think is a great one is, what's been your experience and thoughts on working with loved ones, family, and friends, especially when there's a complicated relationship or resistance to receiving? That's from Carly.
That's a good question.
Great question, Carly. Yeah.
I feel like working with family is really tricky. I mean, that's the honest answer. I think if I decide to work with family members, and I can even think of this as just sort of it's not exactly what you're talking about, but I can remember going to a family birthday party. It was one of my aunt's 90th birthday, and at some point all the relatives are going, "Oh, Jackie, work on my back, work on my back." I didn't really want to be doing that, but my point is that when it comes to family, it's really hard to say no, even if it's not what is best for me. And the only thing I would say to you is you really have to trust that intuition. If it doesn't feel like you're ready to work with that person, at the very least, try to have a conversation and just say, at this point, I'm not really able to give you a massage. There may be another time that I can do that. But being as honest with yourself, and I always feel like honesty in all situations is the best policy, and doing it as softly and factually and tactfully as possible.
Yeah, I have a little comment for Carly too, because I remember that as well. And one of the things that we teach at the massage school, and actually one of the things that was very life-changing for me about being here at the school, was really practicing and learning really good communication skills. And that was something I really wasn't taught as a child growing up, how to communicate what I'm feeling and what I'm needing. And you reminded me of that when you talked about how it can be tricky working on family and friends when there's a complicated dynamic and things like that. And it's so amazing to start using some of the techniques and basic communication skills that we learn here in our program, and then transferring that to our relationships with family and friends, whether that be in the context of a massage or just in our day-to-day relationships, and how it really changed things for me. And I think that serves us really well in all of our relationships, both professionally and personally. So I hope that helps your question.
And I think, we talk about this a little bit when we teach boundaries and ethics.
Yeah.
You kind of have to build the communication muscle and the
Yes.
verbal muscle. It takes like little steps like anything else, being able to say one little thing that I really feel, or be really honest with people. It's like little steps.
That's great. What's next, Sarah?
Well, I really appreciate, I think I was hearing in the conversation, respecting resistance as a thing.
Yes, that's a great way of saying it. I love that.
Another question we have from Gloriane. She was asking both, would you start a massage out with myofascial release, and do you phone call after each session?
That's a good question. Myofascial release, I feel like, is somewhat up for interpretation. So I would say if you mean some very deep tissue work, or that type of thing, I would do that. If it was a brand new client, I would explain what the sensation might feel good. I might use words like, sometimes this may hurt good, or it should be tolerably uncomfortable. So ways where you're not, tightening up. So if I was going to start with an intense type of stroke like myofascial, I might use those words first. And then what was the second part of the question?
I think when we were talking about things to do,
Oh,
Sarah, are you there?
I
Go
am
ahead.
now, I'm sorry.
That's all right.
When we were talking about things beyond the technique, Gloriane was asking, do you follow up each session with a phone call?
oh, yeah,
Right.
yeah, thank you. Right. And I probably would with somebody who doesn't text. I often now use texting as a way to follow up, because I feel it's a little less invasive, and people can answer at their own leisure, and also they don't even have to answer. But I almost always, with a brand new client, I will write them a text, and I will say, this is the next day or the day after. I'm checking in. We did a lot of work. Let me know how the massage worked for you. So I almost always do that, especially with somebody who I've just worked with for the first time. But even with seasoned clients too. Yeah.
Great question. What's next, Sarah?
Awesome. So we have from Chris Roeder, from a client perspective, 2 questions. What's the current status of your operations with respect to pandemic happenings? And also, do you use CBD oils in your massage, and what is it effective?
Good questions. Okay, the first question is, yes. We just opened my clinic 2 weeks ago, and I won't go into a lot of COVID-19 details, but I will tell you that we've made our clinic very CDC sort of recommended, furniture changing, removal of things, hand sanitizer. So yes, we've done that, and even within our massage as well. Then in terms of the second part of the question,
CBD oil.
is the CBD oil, yeah, and that I could probably get on a soapbox, and I won't, because I feel like I was actually very interested in the results of CBD oil when it became a really sort of popular, trendy thing. And what I did was, and this is kind of my own MO in anything, I started doing a bunch of research. And I have a couple friends who are chemists and actually pharmacists, and I asked them if I could get some of their research from some of their documents and their publications that were factually based. And what came out of that is that the quality of CBD oil is so varied that when you buy something, if you don't have it independently tested, you don't really know what the quality of that CBD oil is. And the effects on soft tissue and tension, very little research. Because it's been illegal for so long, it's really not had a lot of documented research. The 2 of the things that seem to have been documented are glaucoma and epilepsy in terms of cannabis. And other than that, like softening muscles or making you relax, the jury's still out. So if the jury's really out, I don't feel like I feel qualified to use that with people if I don't really know the documentation or the science behind it.
Awesome.
Great. That's a good question, Chris. What's next, Sarah?
Thank you so much. Yeah, we're covering most of them, and I think another question we can go to is, like, what advice would you give in going back to beyond the technique? If someone's working at, for example, a spa, and they feel kind of constricted by the practices there, how can they bring the beyond the technique things to their workplace?
That's a great question.
Yeah.
It's very tricky when you're in a franchise situation or some type of spa situation where you're dictated what kind of technique you use, how long you use, how many strokes you use. And the only thing I can say is that all the beyond the technique matters even more to retain and have clients, because when that person walks in, am I just another massage therapist in that, big pile of them, or how do I stand out? Do I look that person in the eye and say, hi Sarah, I'm Jackie, it's really nice to meet you, and I remember you told me about your daughter last week, how's she doing? So some kind of rapport establishment, even with clients who come and go, I think is going to make you stand apart, even if your technique is kind of indicated by other people.
Really good. Anything else, Sarah? Any other questions that you might have for us? I do have one more question for Jackie, but I just want to make sure if there's anyone waiting in the wings. Go ahead.
I think that's great. I think it's a good time for that.
Okay. So Jackie, one of the things that we've been talking about in doing our live streams is one of our themes that we talk about at FSM and in our catalog, and that is living life on your own terms. And I just wanted to ask you as a last question, with massage, what does it mean to live life on your own terms?
Okay. I feel like that's why I went into massage, so I can live life on my own terms. And massage really, and teaching too, but has afforded me the opportunity to be a mom twice, not miss very much of my kids growing up and all their special occasions of high school and college graduations, and being able to schedule my clients to where if I'm a nature person in the morning, which I am, being able to not take clients till later, being able to schedule vacations when I want to go away, and so having that independency and as a massage therapist, it's why I have this career. It's why it's lasted me for 34 years. It's how I do live my own life. And on top of all that, one of my clients she's in her 90s now, she used to come and she used to say, oh, this is the only kind of therapy I look forward to.
Aww.
Yeah, and to have people come to you rather than the dentist or the doctor, right, and say things like that, it's such a gratifying experience. So living life on my own terms and being able to really give back to people it's like the best of both worlds. Yeah.
That's so wonderful. And I think you're right. When in healthcare, it's such a privilege and an honor to be able to spend like 60 minutes, 90 minutes, whatever you choose to do in your time frame, to be able to give our undivided attention to someone for that amount of time is a total privilege, and definitely a wonderful aspect to the profession that we're in. So thank you for that. All right. Well, I just want to thank you, Jackie, so much for joining us today. And if you all listening out there would like to connect with Jackie and learn more about advanced massage professionals and the advanced sports massage training, you can visit Jackie's website, which is advancedmassageprofessionals.net. and we'll put that in the show notes for you. And if you've enjoyed your time with us today, you can subscribe to our YouTube channel by hitting the subscribe button. You could also hit the like button and share it with your friends, and click the notification button to get a reminder. You can also follow us and like us on Facebook. And if you'd like to learn more about our school, you can visit our website at floridaschoolofmassage.com, and you can register for our live stream there or our newsletter, and you can contact us there, and we would be happy to connect with you and share more information and keep you informed about our new class starting, and even set up a live call so that we can meet with you face-to-face over the internet for now. Again, we have a very special event next week. We'll be doing our next live stream on Friday, May 29th at 1 p.m. Eastern Standard Time with Benny Vaughn. And you heard Jackie mention Benny, and Benny will be speaking with us, and I could spend another hour just describing his career, but I'll leave that to him. And he's one of Massage Magazine's 50 most influential professionals of hands-on soft tissue therapy in the world over the past 100 years. That's what it said in the special edition of Massage Magazine. Yeah. He's also a University of Florida College of Health and Human Performance Alumni Hall of Famer. He just comes to us with this lifetime of experience. I think he's turning 70 this year. I hope I got your age right, Benny. He's a massage therapist, teacher, coach, athlete, and it's just an honor, what can I say, to be speaking to him. And when we were talking to him about joining our live stream, he quickly decided that the topic would be massage therapists as second responders in this extraordinary time of COVID-19. So I really look forward to talking with him about that, and I so hope that you can join us. And again, thanks again, Jackie, my pal, my friend. And Chrissy Martinez and Sarah Thompson for being behind the scenes with all of your great support, and all of you watching. It's been such a joy to be together. And until next time, stay safe, be good to yourselves, be good to one another, and we'll see you soon, I hope. Bye for now.
Bye.